Welcome to today's capsule where we'll be discussing everything you need to know about cancer. Cancer is a complex and often misunderstood disease, but with the right information, we can demystify its causes, symptoms, treatments, and more. Whether you're facing a cancer diagnosis yourself or just looking to become more informed, this video has got you covered. Let's get started. Before we continue, feel free to like the video and subscribe to our channel, which will help us enormously be more successful. Understanding cancer is important in order to appreciate the complexity of the disease and its impact on millions of people worldwide. Cancer is the abnormal growth of cells that have the ability to invade surrounding tissues or spread to other parts of the body. This uncontrolled growth of cells is caused by changes to the DNA within cells, which can be triggered by various factors such as genetics, environmental exposure, and lifestyle choices. There are many different types of cancer, each affecting different parts of the body and with varying symptoms, progression, and treatments. Cancer can be classified based on the type of cell it affects, the area of the body where it starts, and its stage, which refers to its size, location, and whether it has spread. Cancer can range from benign, which do not spread and do not pose a threat to life, to malignant, which are life-threatening and can spread to other parts of the body. Understanding the different types of cancer, their causes, and symptoms can be crucial in early detection, diagnosis, and treatment, leading to better outcomes for patients. It is also important to understand that cancer is not a single disease, but a complex group of diseases with varying characteristics and treatments. As medical advancements continue, there is hope for a future where cancer can be prevented, detected early, and effectively treated for millions of people. The causes of cancer are complex and multifaceted, with a combination of genetic, environmental, and lifestyle factors playing a role in its development. Genetic factors, such as inherited genetic mutations, can increase the risk of developing certain types of cancer. Environmental factors, such as exposure to carcinogens such as tobacco smoke, UV radiation, and air pollution, can damage DNA and trigger mutations that lead to cancer. Lifestyle choices, such as unhealthy diets, physical inactivity, and excessive alcohol consumption, can also increase the risk of developing cancer by damaging DNA and altering cell function. Chronic inflammation, a condition where the body's immune system is activated for prolonged periods, has also been linked to the development of certain cancers. The use of certain medications, such as immunosuppressive drugs, can also increase the risk of developing cancer by suppressing the body's natural defense mechanisms. It is important to note that not all causes of cancer are fully understood, and ongoing research is needed to better understand the complex interplay of genetic, environmental, and lifestyle factors that contribute to its development. It is also worth noting that not everyone with a high risk factor will develop cancer, and many people without known risk factors may still develop the disease. Understanding the causes of cancer can be important in developing strategies for cancer prevention and early detection, leading to better outcomes for patients. The symptoms of cancer vary depending on the type and location of the cancer, as well as its stage. Some common symptoms of cancer include fatigue, unexplained weight loss, fever, and pain that does not go away. Cancer can also cause specific symptoms, depending on the type and location of the cancer. For example, lung cancer may cause coughing, chest pain, and shortness of breath, while breast cancer may cause a lump in the breast, changes in the skin over the breast, and discharge from the nipple. Cancer can also cause symptoms related to the spread of the disease to other parts of the body, known as metastasis. For example, bone cancer may cause pain and swelling in the affected area, while liver cancer may cause jaundice, abdominal pain, and weight loss. It is important to note that some people with cancer may have no symptoms at all, especially in the early stages of the disease. This is why early detection and screening are crucial in detecting cancer at its earliest and most treatable stages. If you experience any persistent symptoms that do not go away, it is important to consult with a healthcare professional for a prompt and accurate diagnosis. Understanding the symptoms of cancer can be important in detecting the disease early and improving outcomes for patients. The diagnosis of cancer is a complex process that involves multiple steps and tests. A healthcare professional may suspect cancer based on the patient's symptoms and medical history, and may perform a physical examination to look for any signs of the disease. The first step in diagnosing cancer is often a screening test, such as a mammogram for breast cancer or a colonoscopy for colon cancer, which can detect the disease at its earliest and most treatable stages. If a screening test suggests the presence of cancer, further tests may be performed to confirm the diagnosis and determine the type and stage of the cancer. These tests may include a biopsy, where a small sample of tissue is removed for examination under a microscope, imaging tests such as X-rays, CT scans, or PET scans, and blood tests. The results of these tests are used to determine the type and stage of the cancer, which helps guide treatment decisions. It is important to note that a diagnosis of cancer can be a life-altering event, and it is important for patients to seek the support of loved ones and healthcare professionals as they navigate this challenging time. Understanding the process of diagnosing cancer and the tests involved can be important in ensuring early detection and accurate diagnosis, leading to better outcomes for patients. The treatment of cancer depends on the type and stage of the disease, as well as the patient's overall health and personal preferences. Some common treatments for cancer include surgery, radiation therapy, chemotherapy, and targeted therapy. Surgery is often used to remove the cancer and some of the surrounding tissue, while radiation therapy uses high-energy radiation to kill cancer cells. Chemotherapy uses drugs to kill cancer cells and shrink tumors, and may be given as a pill, injection, or through a vein. Targeted therapy uses drugs that target specific genes or proteins that drive the growth of cancer cells, and may be used alone or in combination with other treatments. In some cases, immunotherapy, which uses the body's own immune system to fight cancer, may also be used. Hormonal therapy, which blocks hormones that fuel certain types of cancer, may also be used to treat certain types of cancer. Stem cell transplant, which replaces damaged or destroyed stem cells with healthy ones, may also be used to treat certain types of cancer. It is important to note that cancer treatment can cause side effects, and healthcare professionals will work with patients to manage these side effects and ensure the best possible outcome. Understanding the various treatments available for cancer can be important in making informed decisions about care and improving outcomes for patients. Preventing and managing cancer involves a combination of lifestyle changes and medical interventions. Maintaining a healthy diet that is low in processed foods, high in fruits and vegetables, and rich in fiber can help reduce the risk of cancer. Regular physical activity, avoiding tobacco and excessive alcohol consumption, and getting regular screening tests for early detection can also help reduce the risk of developing cancer. For those with a family history of cancer, genetic counseling and testing may also be recommended. It is also important to protect oneself from environmental factors that can increase the risk of cancer, such as exposure to sunlight, certain chemicals, and pollutants. In addition to these lifestyle changes, medical interventions such as vaccinations, taking medication to lower the risk of certain cancers, and surgery to remove precancerous growths may also be recommended. For those living with cancer, managing symptoms and side effects is also a critical aspect of care. This may involve pain management, physical and occupational therapy, support groups, and palliative care, which focuses on improving quality of life for those with advanced cancer. Understanding the steps that can be taken to prevent and manage cancer can be important in reducing the risk of developing the disease and improving outcomes for those living with cancer. We hope that this video has provided valuable information and insights about cancer, and has encouraged you to take an active role in your own health and well-being. Remember, early detection is key, and taking care of your body and mind can help reduce the risk of developing cancer. If you or someone you know has been diagnosed with cancer, know that you are not alone, and that there are resources and support available to help you through this journey. And that's a wrap on our video. Thank you for watching, and stay healthy. Don't forget to like and subscribe for more interesting content. See you in our next capsule.